Story today clearly is the fact that the UK drug regulator has approved the AstraZeneca vaccine. That is something which is important because that means that the Indian regulator now could use, if they want to use, they can use that for benchmarking purposes. What does that mean for vaccine rollout in India? Are we prepared? What should be the SOP for vaccine rollout, and what should you and me really think about before receiving a vaccination? To discuss that, let me bring on board Dr. Rahul Pandit. He represents critical care for Fortis Mulund, and I must share with our viewers that Dr. Pandit and his team have really been on the front foot against the COVID war. In fact, Fortis Mulund has done an exceptionally strong work of fighting the COVID war, and I've heard really magical stories of patient recovery there. Dr. Pandit, thank you for joining us. It's the first time I'm interacting with you on ET Now, so a very warm welcome, and let me also extend season greetings to you.
Thank you very much, and my season greetings to you as well. Thanks for having me on the show.
What should we expect now that the UK regulator has approved the AstraZeneca vaccine? What should be the next sequence of events and news which should unfold in India?
I think it's a very important thing that, one of the major countries who have got very strong FDA processes actually looked at the data and gave an emergency approval for the vaccine to be used for their citizens. And I think we need to follow the same process. We need to look at our FDA needs to look at the phase 3 data, which the company is basically providing, the AstraZeneca and the Oxford is basically providing. Look at the safety aspects and roll out the vaccine if the safety aspects meet as per our standards and expectations, which I believe should now be possible because our standards are not going to be very different from the UK standards, if anything, and we should be able to have this vaccine rolled out to our population maybe in the first week of January or so coming forward.
If the vaccine indeed starts rolling out, how soon do you think the COVID chain would break? Because it is important to perhaps explain this to our viewers that vaccines itself may not control the virus. It is the vaccination. But when the rollout will happen, how soon do you think the entire chain will start breaking?
So I think it's a very long process. For the chain to break off, it's a long process. It took us years and decades to actually break the chain for some of the other viruses which the country has grappled to. For example, polio virus or smallpox virus. It took us a decade to do that. But right now, what we are looking at is a virus which is almost like the H1N1 virus or the influenza virus, which is a viral infection which are looking. It's a different type of a virus. It's a coronavirus group which we are looking at. So what we need to do is we need to have an understanding of what is the current sero survey, which is basically showing the amount of population which is likely to be having antibodies in the country. Then we have this critical mass, which the government of India has been talking about, of around 30 to 40 crore people who would basically receive the vaccination in the first half of the year, say up to June or July. That would basically bring up more than 50 to 60% of the population, including the ones who've got antibodies and the 30 to 40 crores, which we are going to basically vaccinate, to a critical mass which has been vaccinated. That's when you will see the virus being slowing down. So what I'm trying to tell you is that it will not break the chain. It will probably slow down and come into a process where it may become from pandemic, it may become endemic in the sporadic areas in the country. So our guard has not to go down. The guard has to be kept up even though the vaccination is there. Even if the people are being vaccinated, they still need to use the masking, social distancing and sanitization processes to continue for the whole year at least. If we are able to do that and then able to vaccinate the rest of the population, that's when we will see actually the coronavirus chain breaking down and going down. So I don't see it happening in the 2021 at all. I think by the end of 2021 or early 2022 is when we'll be able to see that the coronavirus is basically under some control.
So even when people are meeting in small groups or if they're meeting friends and family, you would say despite the vaccine rollout, please don't throw away your mask.
Absolutely. In fact, if you look at the months of September and October, when the Diwali and the other festivities were going on, it was these very small family gatherings which were actually the super spreader events. What has happened is there is a significant amount of young population in India, which is very fortunate, who actually don't have a lot of symptoms. So that's a good part of it, that they are asymptomatic patients. But unknowingly, these people, these asymptomatic individuals are actually going in small gatherings like family gatherings or small weddings where we are allowing 30 to 50 people to gather. And those are becoming the super spreader events. So I have seen at least 5 or 6 families, entire families getting infected after they attended a small function within the family, or after they had a Diwali celebration together as a family. And this is just in my hospital. Imagine how many other hospitals must be having these kind of patients reporting to them. So these are actually the small events, are actually the super spreader events, which we need to be very, very careful of. And we need to be making sure that we don't throw the mask away in these events as well.
Doctor, there's a lot of curiosity as to the rollout of the vaccine, and while some has already been talked about in terms of trial runs and of course priority given to medical professionals and so forth, there was also talk about it being available in the private market by March possibly. Could you share with us perhaps a little bit more on really how you see it reaching the market, what the options may be?
Yes, I think that's a very important question again. So as you rightly said, the first rollout is going to be for healthcare professionals, which includes doctors, nurses, and paramedical staff, which in our country, we may be looking at around 1 to 2 crore people approximately who would be receiving the vaccine under that initial rollout. Then it would be probably the second layer of frontline workers, which are the sanitization workers, the policemen, and so on and so forth, the military, paramilitary, who would probably get it. And then simultaneously, we would have those populations who are above 50 years of age and who have got comorbidities. Comorbidities, which we know now are affecting COVID and are actually making them more susceptible to an infection and perhaps even having a severe infection, which is obesity, diabetes, hypertension, kidney failure. So these 4 or 5 comorbidities would be the patients who would probably get it first. And then the next would be below 50 years of age with comorbidities. And then it would be the general population. So that's the phase out which we are looking at. And this whole process may take up to 6 to 8 months for the frontliners and the comorbidities patients to be actually vaccinated across the country, which is the critical mass of 30 to 40 crores is what I mentioned about. Now, coming to the point of would this vaccine be coming into the private market or not? I think there would be a time when it would probably come into the private market. Currently, there are no such plans by the government to actually roll it out in the private market. Currently, it is going to be strictly controlled by the government. I think there are a lot of concerns among the people that should I be taking a vaccine or not? Are there any side effects? And if there are side effects, what are those side effects? If a person has had COVID, should he be taking a vaccine or not? These are the concerns which are there. And I would like to basically assure and make people aware that vaccination, of course, everybody has got a right, a voluntary right to sort of say yes or no. But in a public health system, when we are talking about, it is better to actually trust on the government who has taken due diligence to actually pass through or give an emergency approval for a vaccine, and then go ahead and take your vaccine when your turn comes in. Because that way you will be a part of the group who is actually vaccinated or not a part of the group who are choosing not to be vaccinated, and you would be left vulnerable. That's one problem there. The second aspect is that those people who choose to take vaccine and maybe they've had COVID in past, it doesn't matter. It has been fairly proven that even if you have had COVID and have some antibodies, the vaccine is probably going to only help you in building more antibodies and not going to cause any harm. Now, as far as the side effects are concerned, everything has a side effect, and the safety margin is looked at only when you have a benefit which is far outweighing the risks, and that's when the emergency approval is given. So some mild side effects like a bit of body ache, a bit of a fever for a 24 hours time after the vaccine has been given or not are quite common, and they should not be deterrent for actually people using vaccines. Yes, people who are immunocompromised, people who are on medicines which make them immunocompromised, they should seek their doctor's opinion before taking vaccine. That's the only caution which I would say. Rest everybody else can take vaccine. People who have had COVID in the last 1 month may choose to wait for another couple of months before they go and take vaccine. But anybody who is more than 3 months in their COVID illness can safely take a vaccine. That should not be a problem. So these are some of the suggestions for and reassurance for the general people, which I would like to say. Apart from that, there should not be any concerns about whether this vaccine is better or the other vaccine is better, because there are different vaccines which are rolled out. The one Oxford vaccine which is rolled out in UK right now is a vector-based vaccine, whereas the Moderna and the Pfizer vaccine are mRNA-based vaccine. There are different technologies and different ways in which they help the body to produce antibodies.
Okay. Just to wrap it up with one question about the second mutation of virus, which in a sense has been spotted in India. How dangerous that could get, because vaccine will take its time, and by the time vaccine is going to be rolled out, the mutation of this new virus could also start spreading.
So again, a very pertinent and topical question. So viruses, by the virtue of the fact that they are actually quite intelligent and they are known to mutate, the general belief is that even before the humans were basically evolving, the microorganisms were present in the world for millions and millions and billions of years before that. So they have a very, very active mutation possibility which keeps on happening, and that's a very natural process for any virus to mutate. So when you have these small mutations, we call it as the antigen drift. Now, if an antigen drift is happening, then usually the vaccines which are being produced right now are able to cover up most of these antigen drifts, and we should not be worried that whether the vaccine would be actually covering up this antigen drift or not. So I think the vaccine will actually be quite useful in patients who have had, for this new virus, the new strain as well. As far as the concerns for this new strain for India are concerned, I would again like to basically tell people that let's not panic. This strain has been identified in UK right from probably September end, and restrictions for travel only came up in this month, in the last few weeks. And we would be naive to believe that none of them actually have passed across to the country, because there were at least 30 to 40,000 passengers who must have come from various European and UK destinations to India. So I would say that as of now, we are in a good space. The numbers are coming down. As long as we keep up with our mask sanitization and social distancing, there is no other precaution which we need to take up for this vaccine, this new virus strain. Yes, it is thought to be 70% more infectious than the other ones, but the preventive measures remain the same. Now, what remains to unknown at this point currently is whether this is more virulent, means whether this new strain actually causes a more severe form of corona. And from what we are seeing in the ICU right now and seeing in the hospitals right now, we are not seeing a very different virulent strain or very bad patients who are presenting. Of course, this needs to be studied at a scientific level. We need to follow up those patients who've had this new strain and see how they are behaving before we can come to any conclusion. But I would like to assure everyone that there is no need to panic. If we continue with our virtues right now of having the corona appropriate behavior, we would probably be all right and not have a lot of concerns about this new strain. Currently, there are no patients who have been found in the community. Whatever positive patients have come in those quarantine institution, quarantine centers from where they had been actually sent for testing and the genome sequencing was done. Another one thing which I would like to say is that we should probably be doing more genome sequencing in the community as well, so that we understand whether there is any new strain which is there, or this particular strain which we are talking about, which is more infectious, is already there or not. The genome sequencing needs to obviously increase across the country.
All right. Well, Dr. Pandit, you've really cleared a lot of myths, and you've really broken this entire vaccine and how we should be preparing for it, and the importance of vaccine, and how should we not really getting worried about the vaccine shot very nicely for our viewers. Appreciate your time, and certainly hope to see much more of you going forward.
Thank you very much. Take care. Thank you.
Well, let's take a break. 7% higher for SAIL. That stock is on a tear. It's gone from 40 rupees to current levels of almost 70 in less than 3 months.